providing endurance and trying to improve your muscle strength. So it's otherwise known as weightlifting, to put it just pretty simply.
Gotcha. So, what are the benefits of resistance training?
So, increasing bone health, making your bones stronger, um, building your muscles up, making it so you're not as fatigued when you're
Hmm.
doing any type of activity. Also, it's promoting like anti-aging almost. Like,
Okay.
I've seen actually seniors who, and even younger patients who started to exercise. It has warded off a lot of different chronic illnesses. We're seeing now in Alzheimer's cases, if they start exercising early, there's a benefit then, I should say, more so than doing like puzzles and Sudoku and those activities as far as warding off dementia. And there has been some recent
Interesting.
studies published. So we are trying to get those patients up and walking. It also helps with their balance and preventing falls.
Interesting. So, can you tell our listeners what are good forms of exercise to improve heart health? Hello, listeners. Welcome to Doc Talk Live. As you folks know, Doc Talk is a health show dedicated to educating its listeners about different health topics every week. We do so by bringing on medical experts to answer commonly asked questions. So be sure to send in your questions through Facebook Live on Wednesdays around this time. And as the intro said, you can find more information about our show on Facebook, Instagram, Twitter, YouTube, and of course our website, doctalklive.com. That's DOCLK, talk, DOCTALK live.com. Also, watch or listen to more episodes on the show, of this show on Spotify, iTunes, and iHeartRadio. Folks, my name is Dr. Parin Makadia, and I'm hosting today's show. Joining us will be Dr. Jennifer Bontrigger to educate us and discuss the topic of sports medicine. That's right, sports medicine. Exercise is something that is vital for our health, and Dr. Bontrigger will be talking to us about some forms of exercise, sports injury, and a lot more. So, Dr. Jennifer Bontrigger, welcome to Doc Talk Live. Thank you very much for volunteering your time to be on our show. Please tell our listeners a little bit about yourself.
Thank you. My name is Dr. Jennifer Bontrager. I am a board certified internal and sports medicine doctor out of Highland Village, Texas. My practice is Southern Horizon Healthcare, and you can find us at southernhorizon.org on my website. I also have a Facebook and Instagram account, other Southern Horizon or Southern Horizon Health. I see patients usually ages 13 and older. I oversee the care of many athletes. I've had weekend warriors up into actually professional athletes come and see me. I am also one of the team doctors for the Louisville Independent School District. I really like to do non-surgical sport injuries. I do a lot of discussion of weight loss and endurance training with athletes. I like to talk about running medicine, as I like to do that myself. I also oversee the program at Louisville High School, and I have worked with other high schools in the area.
Excellent. Wow. Very impressive. Thank you so much, Dr. Bontrager, for being on the show today. So let's get started. Now, as you know, with the pandemic, you know how much time we have been spending at home. So tell our listeners, why is it so important to be active and be physically active, in fact?
Over the past year, and I'm sure you've seen this in your practice, many people have gained quite a bit of weight by not watching their diet, lack of exercise, and I've seen how it affects both their mental and physical health. I think by getting them back up into exercising, it does help in both aspects. Most patients who are now starting to get back up and exercise again, feel more energetic. It also helps with brain fog, helps with socialization, gets them out of their depression, feeling blue. They feel more motivated. Obviously, you have the physical health goals and benefits of weight loss, really cutting down calories. I've had people that have noticed that their appetites have changed since they are more active. Both overall from a mental and physical health standpoint, I think it's I definitely encourage it, especially those that have chronic health risk, including diabetes. We want to keep their blood sugars down, heart disease, especially in our middle-aged population, has went up quite a bit. And I'm trying to really focus in on that age group and get them to exercise more, just from the overall stress, because they're having to care for loved ones that are older, and also their younger ones that can't care for themselves. So I do advocate that every single patient visit, every single day that I am in office with my patients.
Great, great. So can you tell our listeners what are some safe ways to exercise during this pandemic?
The main thing is that I ask if they're vaccinated. Most of my patients are vaccinated, and I tell them if you're vaccinated, you now can go outdoors, and you can run, you can bicycle. Some people prefer to exercise indoors, and I really tell them to really watch the distancing. We still are in the coronavirus pandemic. You still can get the coronavirus, even though I've been told by some of my other patients that they don't think they can. But we get them to, really watch going, being in smaller groups, not going to classes that are overwhelming. But if they can get out and exercise, I find that a lot of times if they're outdoors, it does help overall with just the mental health as well, but also going to small boot camp classes like Camp Gladiator classes. I will find that the socialization that they have and the support that they have from others who are basically in a similar situation, trying to get healthy again on multiple levels, has helped my patients with getting back and getting healthy again.
Got it. So here's a very important question, and I'm sure a lot of listeners want to know: is it safe to go back to a gym?
That is really a loaded question. I guess it depends on the patient's where they're going to the gym. If they take standard precautions. Are they having classes that are, basically cramped and don't follow the social distancing of 6 feet? Are they requiring masks? Can the patient tolerate exercising with masks? Because there's some that do.
That's difficult.
Some that just feel that they can't because they either overheat, they have difficulty breathing. So I think that's one is a case-by-case basis. Do I advocate for everybody to go back to the gym? Not necessarily, because some people can't afford it too. So I try to work out other exercise routines with them that might be a little bit more cost-effective, because some of my patients don't have the money to necessarily go back to the gym anymore due to financial constraints. So it really is a yes and no type of question, I would say.
Got it. One other question that I thought of is, are you seeing more insurance companies paying for or covering gyms?
Yes.
Gym membership.
I'll tell you this, before the pandemic, yes. After the pandemic, no. And there was companies like there was Silver Sneakers with Medicare and the Medicare Advantage plans that were covering it. I'm not sure if they're still doing that, only because a lot of my seniors that I do have, either they're not interested in going, too concerned about their health to go, but some of the insurance plans were covering that. And I know that some of the larger ones, United Healthcare, I think, has backed off. Cigna has backed off. But they are still wanting them to come in and have their overall assessments performed, just because they want to see if their insurance premiums have to be adjusted based on the patient's overall health.
Got it. Okay. Yeah. Speaking of silver sneakers, I think my dad has that, and I don't know which Medicare Advantage plan he has, but yeah, it's very helpful.
Yeah.
So let's talk about children a little bit. In this pandemic, do you think it's safe for children to play sports?
I, for the most part, yes. And I say this with the understanding that the child is of age that they know how to follow directions, because we always want to advocate for a child to be healthy. And I think now more than ever, I've been seeing a lot of my teenagers that have missed the sports and have really not being able to go to school in some districts, have really made it hard on their mental health. So I think if they are doing things correctly in their screening, which we did with my athletes during the fall, and if they are properly masking when they can, and being smart about their exposure risks, I think that a healthy young patient or adolescent who doesn't have underlying health issues can be safe to go back and play. I know that where I was on the sidelines with Louisville High School, we played through pretty much the whole season before the vaccines came out, and we did have screening protocols in place. Just being smart about how you're screening and your exposure risk, and if the child or the adolescent can follow directions, I think that they can be safe to go back.
Got it. So, can you explain the cardiac abnormalities seen in children who have been exposed to COVID-19?
Yes, so there is a syndrome that's called multisystem inflammatory syndrome that has been found in some children that have had severe coronavirus infections, where they have been hospitalized either for 24 hours, but they've had to be hospitalized or they've had to have a severe infection. What we've been finding in those individuals is anything ranging from cardiac arrhythmias, enlargement of their aorta or their ventricle, which are the chambers of the heart, up into myocarditis. And the concern especially is for myocarditis, especially in athletes. You'll probably hear a lot about the pro athletes in the NBA, NFL, even down to college, is that we've been very careful about really watching for that type of injury, because as you know, that can damage the heart and it can be permanent. And we don't want to put the patient into any type of heart failure. If they have been exposed and they've had a severe type of case of corona, we usually will screen them, and they will go through a whole cardiac workup, including exercise stress testing, cardiac enzymes, which are basically blood work to see if there's any specific damage to the heart. Echocardiograms have been used, and now they are advocating cardiac MRIs, which we just had a meeting that I was part of for American Medical Society of Sports Medicine that I'm a member of, and how to deal with athletes at various levels and how to get them back into play with coronavirus. And this extends out from, teenager up into pro athletes. So we are seeing various cardiac issues that have taken place. A lot of it still is evolving, just because we don't know a lot about corona still. And as we're learning, we're finding more and more abnormalities. We just don't know how long these are going to last for. So that's kind of the question long term. Is this going to be something that they're going to have indefinitely, especially if there is damage? It's right now it's kind of a mixed bag, especially if they're younger. We don't know what's going to go on with their health long term.
Very interesting. For the folks who are just joining us, you are listening to Doc Talk Live, and we have Dr. Jennifer Bontrager in the studio with us, and we're discussing sports medicine. Just to shift gears a little bit, can you tell listeners what is resistance training?
So, resistance training is a combination of where you are combining endurance and trying to improve your muscle strength. So, it's otherwise known as weightlifting, to put it just pretty simply.
Gotcha. So, what are the benefits of resistance training?
So, increasing bone health, making your bones stronger. Um, Building your muscles up, making it so you're not as fatigued when you're
Mm-hmm.
doing any type of activity. Also, it's promoting like anti-aging almost. Like,
Okay.
I've seen actually seniors who, and even younger patients who started to exercise. It has warded off a lot of different chronic illnesses. We're seeing now in Alzheimer's cases, if they start exercising early, there's a benefit than, I should say, more so than doing like puzzles and Sudoku and those activities as far as warding off dementia. And there has been some recent
Interesting.
studies published. So we are trying to get those patients up and walking. It also helps with their balance and preventing falls.
Interesting. So, can you tell our listeners what are good forms of exercise to improve heart health, the cardiovascular health?
So, anything that's going to stress your heart, and
Mm-hmm.
you want to get your heart rate up to a certain point, like 80% of what what your heart rate would normally be, without overstressing it. So that could be anything from taking a brisk walk to bicycling. Swimming is a really good one, especially for patients who have severe osteoarthritis and can't tolerate walking for prolonged periods of time. I also have advocated like small little jogs,
Mm-hmm.
but also doing some what we call HIIT exercises, where they do high intensity interval training.
HIIT.
Yep.
Okay.
And those are about 20-minute exercises that you can do. And there has been benefit that they found, which is better than sometimes exercising for an hour or longer. And you do like little increments called Tabatas,
Okay.
and you'll do basically a 30-minute interval or 30-second interval of a specific type of exercise where you do sit-ups or push-ups, and you repeat that about 4 to 8 times depending on what exercise you want to do, what area you're looking to improve, whether that be your lower body strength or upper body strength. I actually am doing that myself just because I want to improve my running speed. And I found that my running speed has improved since I've been introducing that into my exercise routine. So, and I've seen some of my other patients and how it has changed not only just their body composition,
Mm-hmm.
but they tell me that they feel more energetic and they can do more as far as like lifting and their endurance.
I
So.
see. Okay. Very well. So obviously exercise is a big portion of it, but diet also is another big portion.
Mm-hmm.
So what are some of the important foods to consider having on a regular basis that you would recommend?
Definitely, people are very anti-carb, as you know. That's like the taboo word. But you do need carbohydrates, especially if you are performing endurance or any type of strength training, because you need those for your energy builders. Those are the ones you're going to basically use first as your energy blocks. So you do have the difference between your healthy and your unhealthy carbohydrates. So you want to look at stuff like quinoa and oatmeal, but also like the vegetables that you eat too, carrots, corn, sweet potatoes. We tell patients that there are good carbs, believe it or not. I also advocate for proteins in each of our meals and making sure that you have proteins, because those are kind of the backbone of what you will also utilize during a longer period of exercise. And then you get into your fats. And again, we've talked about keto diets with my patients and all that. There has been a lot of questions about keto, and I am not a particularly overwhelming fan of it because I don't know if some of the patients out there are getting good advice on it. And I've seen issues with liver enzymes actually elevating when they are on the keto diet because they're being told to put butter in their coffee, which is, again, not what I advocate. But you want to have healthy fats. So you want to have your olive oils and even a little bit of coconut oil, which there has been conversation in the cardiology community about how much you get. It is a healthy type of fat. And there are other healthy fats too, avocados, that we advocate for. And you want to have a breakdown of each of them in your diet, especially if you are doing certain types of training. Endurance training is going to use a little bit more of the carbohydrates, protein type of regimen, where your weightlifters are going to use more of your protein and more of your fats. And women are going to utilize carbohydrates a little bit different than men. So you want to set it up based on not only what exercise they're doing, but the gender. And I find that women do not utilize, or they don't break down sugars as well as men does. So,
interesting.
You want to kind of base their diet a little bit more toward a protein based diet with either endurance or strength training.
Got it. So for the folks who are just joining us, you are listening to Doc Talk Live, and we have Dr. Jennifer Bontrager discussing sports medicine. So if someone wants to lose weight and they're wondering if caffeine can help burn fat, what would you say to that?
I would be, well, I will tell you this. In of itself, no. But there have been studies. There was one that came out probably about a year ago where they had studied a group of males, primarily in the ages of their mid-30s into their early 40s, that looked at their consumption of caffeine. And they said a large quantity and it's strong. And it wasn't defined necessarily of how many grams of caffeine that they were taking in, but I'm assuming about 250 grams, which is a lot, or higher. And they found that while these individuals were exercising, and if they exercised at a certain part of the day, which was usually midday, it helped them to lose some weight versus their controlled subjects. Now, to be careful with that is, the interpretation that you have to take away from this is that in of itself, I don't think it's going to make much of a difference, because if that was the case, I think a lot of people would be walking around thin, Starbucks would be, they would be definitely raking in more money than what they are right now. But I think that it does play a role because it does help with endurance at this point. Okay. And so just and also too is that if you are more on the lines of doing professional sports, college sports, that type of thing, caffeine can be one of those things where it can be considered a substance that they can ban. The problem is that they can't track it a lot because of how we metabolize it. So if you're drinking too much coffee, because it is something that can help with sports performance, it can be considered, on the banned list. But again, it really depends on how much caffeine you're drinking, how you break it down, and how they are measuring it, which is usually by urine.
Right? Yeah, that's what I was thinking. So for the high-performing athletes, what are the best way to improve recovery after exercise? And for anyone, in fact, is protein shake a must?
I'll say this: whey protein, whether that be in a shake or something that you eat. Usually, I will tell patients a shake, as long as it's not sugary. I will have them, drink something like that afterwards. It will help with their recovery. It helps with building up any type of muscle, damage. Repairing it basically. Another one that I also recommend is Casein, and that can be used in the evenings. I usually tell them if you don't like cottage cheese, something like yogurt or something
Mm-hmm.
like that. We have them take it near the end of the day, just a little bit. And what it does is it binds in your stomach, and it basically is admitted throughout the night. And that also helps to promote muscle healing and and getting them back up into shape. And I find that that has helped a lot too. There's always been question of what type of proteins and stuff like that, but in the literature, primarily, it's always been whey protein. Within 30 minutes after you get done exercising, to be optimal, and then using the casein at night, or in the evenings, I should say.
Excellent. So we have a couple of minutes remaining until the end of the show, and the summer is starting to come around. So can you tell our listeners, or give our listeners some of the tips you have for exercising in the heat?
So definitely you want to avoid exercising midday. So anywhere from 10 a.m. to about 3 p.m. here in the Dallas-Fort Worth area versus where I grew up in New Jersey, New York area. You might want to kick that back to about 5 o'clock in the evening. You want to stay hydrated. You want to hydrate with Pedialyte or some type of electrolyte drink that doesn't have a lot of sugar in it, and alternate that with water so you don't wash out all your electrolytes and have cramping. Also want to be very light snack or something that you can eat prior to working out,
Mm-hmm.
light clothing. And knowing, is it going to be a really humid area? And if so, changing up your exercise regimen to a different time.
Excellent. Thank you so much. And folks, we're approaching the end of our episode of Doc Talk Live. Remember to check us out on Facebook, Instagram, Twitter, and of course our website. You'll be able to hear the this episodes on podcast. So until then, we'll see you next week. This is Dr. Macadia signing off. Stay healthy, America.